Hello, hi. So today we have Coco. Coco is a little boy that probably has been in contact with either a caterpillar or a caustic, so a very caustic liquid, ending up with a necrotic lesion of the tip of his tongue. This dark tissue will likely drop off at some point, and at the moment Coco is in so much pain that he's not able to either drink or eat. What we're going to do now is we're going to insert a feeding tube through the left side of his neck to bypass the mouth and allow the owner to feed him at home with a particular liquid diet, waiting for this problem to get completely sorted and healed. Okay, so this is the device we're going to use today to introduce the feeding tube. So the kit is made of a metal bar, which is going to work as a guide to introduce the tube from the mouth through the neck, and then to allow the tube to be taken out the neck and then stitched up and attached to the left side of Coco's neck. Then we have the tube itself. This is a proper feeding tube with marks on the side to measure the length of the tube, because we also have to make sure that the tube doesn't reach the stomach and stays into the esophagus in order to avoid gastric reflux and vomiting. The food will be introduced into the esophagus, then by the movements from the esophagus it will go directly into the stomach, but the tube itself will not connect the stomach to basically to the end of the tube. And we will have to introduce the tube with the metal bar. We will have to make an incision and then stitch everything back together. Alright, it's now time to take measurements prior to introducing the tube, the feeding tube. So this is the feeding tube, alright, with all the marks that we're going to use as a guide to actually know exactly how deep the feeding tube is going into the esophagus. We need to consider the feeding tube has to reach 2/3 of the length of the esophagus, no further down. So the stomach is approximately at this level. The tube has to go approximately at this point, and the incision will be made roughly at this level here. So we need to measure the distance between this point and this point, which is approximately this, and we know that the feeding tube will be introduced up to this tiny mark here, no further than that. Okay, so in order to introduce the tube, we need to use this metal bar as a guide. This will be introduced into the mouth and will literally poke in this area of the neck, giving us an idea of where the tube will actually come out. After introducing this, we will have to make an incision on the skin to let this guide come out, dragging behind the feeding tube itself, which will then come out and will be left in place. The next step is now introducing the feeding tube. I have marked here the tube, so I know that once the tube will be extracted, it will not going to be extracted more than this, so it will be exactly the length that we need to stay in the esophagus. So the first step is to introduce the tube through Coco's mouth. It will go automatically into his esophagus. At this point, we don't actually need to take any measurement, and we don't have to be worried about how deep the tube goes. but as soon as we feel a little bit of resistance, it means that the tube is actually deep enough to be left in place. Using the metal bar as a guide, we introduce that one into his mouth, and we just gently go down his esophagus, rotate the bar, and we try to find the right angle to make our incision, which at this point will have to be here. The probe is poking here at this level. The jugular vein runs through this part of the neck. Here we have no blood vessels to hit. So the next step will be then to make an incision on the skin at this level here, to let the probe out. I will need another pair of hands. Okay, I'm now helped by one of my colleagues, one of our nurses. So she's holding the probe down. Now I can see the probe poking here, and I just gently make an incision in order to let the probe out the side of the neck. The esophagus is pushed next to the wall. The probe is now starting to be visible, and now we can take the probe out with some forceps. The probe will guide also the rest of the tube out. And now, with a gentle pressure, we let the tube through the nose, and we'll just take our feeding tube out up to the mark that we had been we put in on the tube prior to the procedure. Okay, the tube is now in place. I found the mark. I left the tube inside. I need to stitch everything up in order to keep the tube anchored to the side of the neck, and then we will have to take a quick neck x-ray to make sure the tube is not actually going too deep towards the stomach. Okay, the tube is now in place, has been stitched up to the skin, so it's not going to come out. The next step will be taking an x-ray just to assess the right placement of the feeding tube. Okay, this is the post-procedure surgery to assess the position of the feeding tube. Now, as we can see, okay, this is a chest x-ray. The head is this side of the x-ray. Here we got the stomach around this level. Now, the feeding tube is nothing else than this slight white line that goes across the neck down here to the chest. And it stops here into the chest, which is good because it means that the feeding tube has not progressed far deep enough to reach the stomach, and is not going to give any reflux or any gastric issue or vomiting, and it's going to be perfect for feeding the dog for the next few days until the tongue recovers completely.